My name is Matthew Kearns, and this is my patient, Amanda Kearns, a consenting adult over 18. Tonight I'm going to be performing a musculoskeletal and neurological exam for Ohio Christian University. So I would come in the room, introduce myself. I'd probably start with a neurological exam. Can you tell me your name and date of birth?
Amanda Kearns, 9/15/1980.
Can you tell me where you are?
I'm at home.
And can you tell me about what time of day it is? Is it daytime, nighttime?
It's nighttime.
Patient is alert and oriented, ×3. Now you would normally do a neurological exam during a routine exam, maybe if there's been a trauma or a change in behavior, like to notice the patient's altered mental status. So next we're going to test motor function. Can you squeeze my hands? Can you push towards me? Can you pull towards you? Good. Motor function's intact. Next we're going to do a little bit of a sensory exam. I'm going to have you close your eyes, and I'm just going to touch the side of your face. I want you to tell me where I'm touching, okay?
Left cheek, right cheek, forehead.
Okay, open your eyes. Next I'm going to perform a dull and sharp test. This is going to feel dull on your skin. This side will feel sharp. I want you to tell me if it's dull or sharp.
Shut my eyes.
You can leave. You can close them.
Okay. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Good. Okay, hang on your eyes. Next I'm going to do what's called the Romberg's test. Can you please stand up? And I'm going to have you close your eyes. Don't worry if you start to sway or something. I'll be here to catch you. So put your legs together. Close your eyes. And you just want to watch and make sure the patient's not going to fall. Normally you sway a little bit. So Romberg's is negative. Okay, you can open your eyes and sit down for a second. So you also want to test each cranial nerve. The first cranial nerve is the olfactory nerve. This is the scent of smell. Okay, I want you to stand up for a second. Can you smell this?
Yes.
Okay. Cranial nerve 2 is the nerve that carries vision to the brain. And we can test the eye with what we call an ophthalmoscope. And I don't have one of those, but we would just look into the eye, check both eyes. Cranial nerve 3 is oculomotor. This nerve is responsible for pupil size and certain movements of the eye. We can use a pen light to check that. And also cranial nerve 4 is the trochlear nerve. This nerve also helps with movement. So I'm just going to take a look at your eyes. Just stare straight forward. So pupils are equal, round, reactive, about a size 4, and accommodating to light. Cranial nerve 5 is the trigeminal nerve. It allows for the ability to feel the face inside the mouth and move the muscles with chewing. So I can have you just go ahead and bite down. I just want to watch as your face. Okay. Cranial nerve 6 is the abducens nerve. This nerve helps with movements of the eyes. I want you to, again, I'll just follow the light or my finger. Cranial nerve 7 is the nerve responsible for various functions of the face, including muscle and taste. This test, you can usually have your patient taste different things like sweet, sour, bitter, or ask them to smile, which I'm going to have you do. Just smile for me. Good. Cranial nerve 8 is the acoustic nerve. This is the nerve of hearing. So I'm going to just do a little hearing test. Just turn around this way. I'm going to whisper behind one of your ears. I want you to tell me which one I'm saying.
Left. Right.
Okay, good. Turn back around this way. Cranial nerve 9 is the glossopharyngeal nerve. This nerve is involved with taste and swallowing. Once again, it's I can test your gag reflex if I had a tongue depressor. I just let this open up. This goes along with the cranial nerve 10, the vagus nerve. I test your gag reflex. I look in the back of your mouth, see, usually moves up and down. That's good. Cranial nerve 11 is accessory nerve. This nerve is involved in the movement of the shoulders and neck. So I'm going to put my hand on your head. I want you to push towards it. Push like this. Okay, good. She did meet the resistance. Cranial nerve 12. This is the final nerve mainly responsible for the movement of the tongue. Yeah, can you stick your tongue out for me? Go up, down, side to side. Good. The next part of the neurological exam, I would do a reflex test. I have a reflex hammer here, and I would test the patient's reflexes. If you want to sit down for a second. You want to test, you test them on a scale of 0 to 5. 0 is absent, 1's trace, 3's normal. Or 0's absent, 1's trace, 2's normal, 3's brisk, 4 is non-sustained clonus, and 5 is sustained clonus. And you want to test the biceps, the brachial radial, the triceps, the patellar, and the Achilles. So for the brachial, let me come over here. Okay. And you want to go side to side on these. Okay. Tricep. Now do there, tricep. Do radial. Radial. Do patellar.